Hello everyone, welcome to my channel Anupma Biology Classes. This is my last video of the immunology series. In this immunology series, today our topic is type of drugs, which is taken from chapter 8, part 8 of CBSE class 12. Before this, in previous video of immunology series, we discussed about drugs and their action. Here we will see different type of drugs and their effect on the body. So let's begin the topic, which is type of drugs, in which first we should know about the types of habituating drugs. So what is habituating drugs and how many types of habituating drugs? Habituating drugs are grouped into two main categories, in which the first one is psychotropic drugs and the second is psychedelic drugs. So what are psychotropic and what is psychedelic? Psychotropic drugs affecting the mind or mental process, while psychedelic is of containing, generating, or reminiscent of drug-induced hallucinations, distortion of perception, altered awareness, etc. Now, psychotropic is a drug or agent, while psychedelic is any psychoactive substance which, when consumed, causes perceptual changes, visual hallucination, and altered awareness of mind and body. So, conclusion is a psychoactive is a chemical or substance that has an effect on the brain or a high, and a psychedelic is a chemical or substance that produces a state that come to be known as psychedelic. A hallucinogenic state is which a person experiences various distortions of their senses, even switching or mixing their senses, such as in synesthesia. Synesthesia would be a hallucination, such as being able to feel something you see or being able to see something you hear. There are often very vivid geometric patterns involved as well. Now, in the groups, it means in two main categories of the habituating drugs. First one, that is the psychotropic drugs, which is divided into many categories, many groups. So at first, what is psychotropic drugs? Psychotropic drugs act on the brain and alter behavior, consciousness, and capacity of perception. Hence, they are also termed mood altering drugs. The repeated use of the psychotropic drugs makes the body dependent on them. Now, these psychotropic drugs are classified into four major categories or groups, in which the first one is tranquilizers, second is sedative and hypnotics, third is opiate narcotics, and the fourth is stimulants. Now, the example of tranquilizer is phenothiazines and benzodiazepines. The examples of sedative and hypnotics is barbiturates and benzodiazepines. Examples of opiate narcotics is opium, morphine, codeine, heroin, smack, pethidine, methadone, etc. And the examples of stimulants are caffeine, cocaine, crack, betel nut, amphetamines, etc. So these are the main classification of the psychotropic drugs. Now we will discuss each and every part in detail in the next slide. So first one, that is tranquilizer. What is tranquilizer? The tranquilizers lessen tensions and anxiety and promote calmness and soothing without sedating or depressant effect and do not induce sleep. Now, if we talk about the examples, that you know that phenothiazines and benzodiazepines are the examples of tranquilizer. So first one, that is phenothiazines. These are antipsychotic drugs. In a psychotic patient, they decrease aggressiveness, remove anxiety, and normalize thought and behavior. Phenothiazine is a parent compound for the synthesis of several antipsychotic drugs like chlorpromazine, thioridazine, rasparin, etc. Now, the second is benzodiazepines. So, what are benzodiazepines? These are anti-anxiety drugs. Anxiety is a disturbance of mind involving restlessness, tension, worry of some uncertain event, apprehension of fear and danger, etc. A certain degree of anxiety is a normal phenomena in life. However, frequent and excessive anxiety need treatment with benzodiazepines. The latter have gained popularity over the barbiturates. Barbiturates we will describe ahead because of more effectiveness, almost no side effects and mild withdrawal symptoms. Benzodiazepine is a parent compound for the synthesis of many anti-anxiety drugs here such as diazepam, oxypam, clonazepam, etc. Diazepam is a hypnotic, that is sleep inducing drug, anti-anxiety and anti-convulsant agent. Oxazepam is an anti-anxiety drug and clonazepam is an anti-convulsant drug. Benzodiazepines should be taken in small doses and should be given up when not needed. Now, here you can see the difference between hypnotics and tranquilizer. Hypnotics and tranquilizer both are the groups of psychotropic drugs. So what are the differences? If we talk about the effect of high doses, in case of sedative hypnotic, loss consciousness, anesthesia and respiratory depression. While in case of tranquilizer, consciousness, only immobility, no respiratory depression. According to sensory reflexes, in case of sedative, depressed. In case of tranquilizer, normal. According to effect on emesis, there is no effect in case of sedative, but anti-emetic effect, inhibition of CTZ in case of tranquilizer. According to anti-convulsant effect, in case of sedative, general skeletal muscle relaxant, while in case of tranquilizer, limited and specific. And the last is pre-anesthetic effect. So in case of sedative, duration not affected, decrease the dose, and tranquilizer, prolonged duration of anesthesia. So these are the main difference between the hypnotics and tranquilizer. Now, the second type is sedative and hypnotics. So what is sedatives and hypnotics? Sedatives depress, it means switch off the activities of the central nervous systems. They reduce excitement, assuage pain, and give a feeling of calmness, relaxation, or drowsiness. Higher doses induce sleep. The sleep inducing drugs are also called hypnotics. So, meaning of hypnotics means making one to sleep. And the examples are barbiturates and benzodiazepines. So, here some definition, that is, what is hypnotic? A drug which produces sleep resembling natural sleep. Sedative, what are sedative? Drugs that reduce excitement, calm the patient, and is commonly used as an anxiolytic. Sedatives in therapeutic closures are anxiolytic agents. More sedative in larger closures produces hypnosis. Sedative, hypnotic both depresses the central nervous system. Hypnotics is higher doses produces general anesthesia. So this is all about the hypnotics and sedatives. Now the examples of the sedatives and hypnotics, in which the first one is barbiturates. What is barbiturates? Barbiturates are the synthetic drugs derived from barbituric acid. They are general depressant and are popularly called sleeping pills. They lessen functional activity, decreases anxiety and induce sleep. Their repeated use causes psychological dependence. It is very difficult for the addict to withdraw from them. Withdrawal causes depression and restlessness. Repeated use leads to barbiturates involving skin eruption accompanied by chill, fever, and headache. Barbiturates are not preferred these days. So here in this picture you can see barbiturate speed. So ultra short acting surgery, short to intermediate acting sleep, and long acting pain or migraine relief. Now be wary of taking barbiturates if you are pregnant, breastfeed and have certain allergies. So this is the structure of, that means basic barbiturate structure. In this picture you can see this is the chemical formula of the barbiturates. Now this is the chemical formula of benzodiazepines. These are anti-anxiety as well as sedative drugs and have been described earlier. You know that in first group, that is tranquilizer, here also benzodiazepines. Due to the anti-anxiety and anti-tension properties of the sedative hypnotics, their abuse has dramatically increased. Now, symptoms of benzodiazepine withdrawal. There are some symptoms here you can see that like aches and pains, delirium, detachment from reality, muscle spasm, and anxiety, panic attacks, depression, nausea, insomnia, grand mal seizures, abnormal body sensation, etc. So these are the symptoms of benzodiazepine withdrawal. Now, commonly prescribed benzodiazepines, which are Ambien, Ativan, Halcyon, Elonopine, Lunesta, Rohypnol, Valium, and Xanax. So these are the commonly prescribed benzodiazepines. Now, after this, third type is opiate narcotics. So, here there are types of opiate narcotics. So, how many types of opiate narcotics? It is divided into natural, second is semi-synthetic, and the third is synthetic. So, these are the types of opiate narcotics. In natural, examples are opium, morphine, and codeine. In semi-synthetic, examples are heroin and smack. And in synthetic, examples are pethidine and methadone. So here in the next slide we will describe each and every part of the opiate narcotics in detail. Now the opiate narcotics medical use. Opiate narcotics are drugs that suppress brain activity and relieve pain. They are popularly called painkillers. They also have sedative and astringent effect. An antistagnant causes contraction of a tissue, arrest of secretion, or control of bleeding. The opiate narcotics are also used for the cough relief and for the treatment of vomiting and diarrhea. Now, if we talk about the examples, the opiate narcotics are briefly called opiates or opioid. They include opium and its derivatives, certain semi-synthetic compounds, namely heroin and smack, and some synthetic drugs such as pethidine and methadone. In the form which we intake it, the opiate narcotics may be eaten, smoked, sniffed, or injected intravenously. According to dependence, the opiate narcotics causes a high degree of dependence in their users. Now, what are the general effect of the opiate? The opiates in general relieve pain, reduces tension and anxiety, lower blood pressure and breathing rate, induce drowsiness and lethargy, reduce glandular secretion, impair digestion and speech, causes nausea and vomiting, produces sterility and constrict the pupil, reducing visual acuity. An overdose may stop respiration and causes death. If the drugs are not available, the addicts show terrible withdrawal symptoms. The opiate also depresses the immune system, especially the cells that fight cancer and virus infection. Therefore, the opiate dependent readily catch infectious disease such as tuberculosis. Now, the first example of the opiate narcotics, which is natural opiate, that is opium. Opium is the air-dried, milky latex obtained by incising the unripe capsules, means fruits, of white poppy plant, that is Papaver somniferum family Papaveraceae, of its variety Papaver album. It has reddish brown color, heavy smell and a bitter taste. Opium has been used as a drug since ancient Greek times because it is the most effective painkiller and also induces a state of euphoria, an exaggerated feeling of well-being, also called high. Opium is eaten or smoked. Some person in villages take opium in its raw form. Now, the opium dependent lost weight, fertility, and interest in work. There are many opium derivatives, so which are 20 alkaloids. Its main derivatives are morphine and codeine. Now, in this picture, you can see here that is morphine. It is the active principle of opium. It was isolated by Surtner in 1805 and he named it after the Greek god of dream or of sleep, that is Morpheus. Morphine is a most valuable analgesic. It is also used as a sedative and an anxiolytic agent. It forms about 10% of the dried exudate of poppy. It is widely used in small doses to relieve pain and induce sleep in cases of serious injury, burns, fractures, and surgeries. However, its continued uses causes dependence. Now, second is codeine. Codeine, it may be obtained from the opium or morphine. It is in fact methyl morphine. Opium contains 0.7 to 2.5% of codeine. It has mild analgesic properties. It does not cause addiction. It is an ingredient of many medicines and cough syrups. A notable side effects of codeine is constipation. Now, 5 side effects of codeine, in which first one is sedation, nausea, shortness of breath, euphoria and dizziness. So these are the side effects of codeine. Now, after this, the next is heroin, which is also known as diacetylmorphine or diamorphine. Heroin is a white or brown crystalline semi-synthetic compound prepared from morphine by acetylation. It is the most dangerous opiate. It is twice as potent as morphine and about 200 times stronger than opium. It was formerly used for the relief of cough. It is highly addictive. It is banned even from medical use except for research. It is prepared and sold illegally because it gives huge profit. International efforts are being made to check its trafficking. Heroin may be orally taken, inhaled, or injected. It induces drowsiness and lethargy. Its after effects include impaired digestion, decreased weight, reduced vision, sterility, and total loss of interest in work. There are additional risks in its use. Being costly, it is often diluted with harmful substances which may cause secondary illness. Syringes and needles used for injection are not sterilized. This may cause blood poisoning, serum hepatitis, abscess, formation of AIDS. So, withdrawal symptoms of the heroin includes vomiting, diarrhea, shivering, running nose, muscular cramps, and epilepsy. Now, here you can see that short-term effects of heroin are euphoria, alternately alert and drowsy state, dryness, warm flushing, slowed breathing, weakness, etc. And the long-term effects are addiction, tolerance, dependence, pneumonia, infection of the heart lining and valves, collapsed veins, decreased function of the liver, and abscessness of systemics. So these are the short-term effect of heroin and long-term effect of heroin. Now, common symptoms of heroin withdrawal are the mood changes, insomnia, aches and pains, heroin craving, diarrhea, fever, etc. Withdrawal symptoms typically last for 5 to 7 days. Now, smack. Smack is a crude byproduct of heroin synthesis and is commonly called brown sugar. Being cheap, it is considered poor man's heroin. The addicts heat the smack powder and inhale its vapor. Smack is diacetyl morphine hydrochloride. It is a stronger analgesic than morphine. Now, pethidine, that is mepridine hydrochloride. Pethidine is a widely used narcotic analgesic. It is sedative and euphoric effect also. It has a local anesthetic action. Now, here you can see that mepridine IR quality test pharmaceutical, that is 50 mg and 100 mg. So normally it has local anesthetic action. Now, methadone. Methadone is an orally effective analgesic. Its action is slightly stronger and longer than that of morphine. It causes psychic and physical dependence, but withdrawal symptoms are mild. It is also used during withdrawal treatment in morphine and heroin addiction. Methadone has a reduced sedative action. Here you can see the symptoms, that means causes of using methadone: confusion, difficulty in sleeping, dry mouth, chest pain, urination problems, weight gain, here hoarse voice, dizziness, headaches, etc. So these are the appearance or symptoms when a person use methadone. Now, if we use methadone, it reduces physical pain, reduce or dull psychological pain, to feel relaxed and detached, to relieve feelings or an anxiety and distress. Now, after this, the fourth main type is stimulants. So the stimulants temporarily stimulate the nervous system, makes a person more wakeful, alert and active, and causes excitement. The stimulants do not cause physical dependence because no withdrawal symptoms appear. Psychological dependence is very likely to occur as withdrawal causes depression and anxiety and restlessness. The stimulants include caffeine, cocaine, crack, betel nut and amphetamines. So, according to classification of stimulants, it is divided into two main parts. First one is natural stimulants, which are caffeine, cocaine, crack and betel nut. And the second is synthetic stimulants, which is amphetamines. Now, after this, the first stimulant, that is caffeine. Caffeine is a mild stimulant. It is 1,3,7-trimethylxanthine. The source of caffeine is a vegetable alkaloid obtained from the dried leaves of tea plant, an evergreen shrub named Thea sinensis of family Theaceae, dried beans of coffee plant, a shrub called Coffea arabica of family Rubiaceae, and dry seeds of coca plant, a small evergreen tropical American tree named Theobroma cocoa of family Sterculiaceae. So these are the three main sources, in which the first one is here, that is tea plant, second is here coffee plant, and the third is cocoa plant. Now, if we talk about the appearance, caffeine is white crystalline, slightly bitter alkaloid. And the mode of use of caffeine is commonly takes as beverages, tea, coffee, cocoa and cola drinks. It is also taken in chocolate bar and the chocolate confectionaries. Caffeine increases metabolic rates of neurons, thereby increasing alertness and thought. It improves performance and removes boredom. Higher doses causes nervousness, restlessness and insomnia. Excessive intake of caffeine causes addiction. Now, health effects of caffeine. So there are some positive effects and some negative effects. According to positive effects, increased attention and alertness, decreased fatigue, lower risk of cardiovascular disease, lower risk of diabetes and increased metabolic rate. While the negative effects are anxiety and addiction, increased vasoconstriction and blood pressure, reduced control of fine motor movements and stimulation of urinations. So these are the positive and negative effects of caffeine. Now, effects of moderate caffeine consumption. It increases attention, increase memory performance, increase intraocular pressure, decreased risk of heart disease, increased physical performance, increased muscular recovery, and decreased risk of liver disease. Now, if we talk about the therapeutic uses of caffeine, caffeine and other methylxanthines are in many medications used to treat a range of ailments. Caffeine is part of many remedies for headaches and colds because its stimulant properties help to counter some of the side effects of those medications. Caffeine is an appetite suppressant medications because of its diuretic effects, and aminophylline, a cardiac and bronchial dilator that contains theophylline, is used to treat both cardiac and bronchial asthma. Now, chronic effects of caffeine use. Research attempting to link caffeine use to medical problems has produced inconsistent findings. One study linked coffee consumption to osteoporosis, yet more recent research suggests that this relationship can easily be negated with small amounts of milk in the diet. Though caffeine consumption has been commonly associated with indigestion, palpitations, tremor, headache, and insomnia, it is still considered a relatively safe drug. So, these are the chronic effects of caffeine use. Now, withdrawal symptoms. Withdrawal symptoms for caffeine leads to headache, disturbed sleep, lethargy. Here you can see that after you stop consuming caffeine, it starts 12 to 24 hours, then peaks 20 to 51 hours, then lasts 2 to 9 days. So headache here 1 in 2. So these are the withdrawal symptoms. That means after you stop consuming caffeine. Here you can see that 10 caffeine withdrawal symptoms, the dark side of coffee. First one, that is the headaches, then fatigue, reduced energy levels, lack of focus and difficulty in concentrating, mental fog, here irritability and moodiness, depression, drowsiness, difficulty getting things done, anxiety, flu-like symptoms, decreased mental alertness, sharpness, etc. So these are the 10 caffeine withdrawal symptoms. So the dark effects of coffee. Now, after this, cocaine, which is also called a stimulant. Cocaine is also known as coca alkaloid. It is benzomethylcocaine on alkaloid. So, cocaine is extracted from the dried leaves and young twigs of the South American shrub named Erythroxylon coca. It is also synthesized from ecognin or its derivative. It is not connected with the beverage cocoa. According to appearance, cocaine is a white crystalline bitter powder, and according to medical use, cocaine is a vasoconstrictor and is therefore used as a local anesthetic. According to mode of intake, cocaine is chewed, eaten, or sniffed in its powder form or taken as a drink. It is injected also. Now, therapeutic uses of cocaine. Cocaine is a CNS stimulant. It increases mental alertness and physical strength. It gives a feeling of well-being and delays fatigue. It causes lack of sleep and loss of appetite. It is taken for excitement by addicts. Its use may ultimately lead to mental disorder and insanity. Its overdose may cause severe headaches, convulsions, and death due to respiratory or cardiovascular failure. Now, crack. Before this, in this picture, you can see the snorting cocaine. So, this is the way or mode of use of cocaine. Now, the side effects of chronic use of cocaine. It increases risk of stroke, reduced attention, insatiable hunger, insomnia, hypersomnia, lethargy, soreness, hoarse voice, hemoptysis, here dyspepsia, infiltrate, chest pain, asthma, fever, eosinophilia, rhinochoria, abrasion, increased risk of infractions, pruritus. So these are the side effects of the chronic use of cocaine. So in case of cocaine high, the psychological effects are intense pleasure, memory of euphoria, talkative, confident, then lethargy, anxious, paranoid. In case of physical effects, full body stimulation, very hot body temperature, nausea, increased heart rate. And in extreme use, heart problems, seizures, death, and addiction. So these are the effects on the body of cocaine. Now the crack. It is a highly potent smokable derivative of the cocaine. When smoked, it results in a brief intense high. Within 10 seconds of being smoked, it provides a dramatic high lasting for 3 to 5 minutes, and afterwards an intense craving for the drug arising in the users. Dependency can develop in less than 2 weeks. Crack is relatively cheap but extremely addictive. Crack may cause complications such as heart and nasopharynx damage, seizures, and mental problems. Crack is also sold as ridges length called teeth or French fries. So here you can see the crack cocaine main physiological effects. Now here betel nut. So what is betel nut? So before this, here in this picture you can see that kernel of the betel nut palm, Erica catechu, enclosed in betel leaves and mixed with an aromatic paste and chewed extensively in India and Africa. It contains an alkaloid ericoline and a red tannin. It is a mild CNS stimulant. It stings teeth and gums red. Now health benefits of betel nut, that is supari. Betel nut prevents oral cavities, prevent stent teeth, reduce swelling in gums, maintain women's health, prevent diarrhea, prevent dry mouth, prevents gum infection, effectively battles indigestion, powers up concentration level, and maintains men's health also. Now, effects of betel nut use on the users: increased risk of cancers, mouth cancer, precancer, white patches on mouth or tongue, leukoplakia. In this picture, you can see the structure of leukoplakia. Then often become very aggressive cancer, that is squamous cell carcinoma. So this is the effect of betel nut use. Now amphetamines. Amphetamines are synthetic drugs commonly called pep pills or anti-sleep drugs. Now if we talk about the effects, the amphetamines are a strong CNS stimulant and produces increased self-confidence and flow of ideas beside causing excitement and alertness. Here you can see that the amphetamines harm and reduction, that is anxiety, paranoia, psychosis, insomnia, injecting complications, speed powder, base speed, liver disease, damage to nose and gums, heart failure, high blood pressure, appetite suppression, weight loss, increased risk of unsafe sex. Now short-term or adverse effect of amphetamines. So adverse effect of amphetamines are abuse and addiction, high body temperature, cardiovascular system failure, hostility or paranoia, irregular or increased heart rate or heartbeat, increased diastolic systolic blood pressure, increased activity, talkativeness, euphoria, heightened sense of well-being, and decreased fatigue, drowsiness. So these are the effects of amphetamines. Amphetamines are prescribed for ADHD, narcolepsy, obesity, and depression. So, according to medical use, amphetamines is used as a spray or inhalant for the relief of cold, asthma, etc. Amphetamines are among the dope test drugs for athletes who use them to stimulate physical and psychological strength. They suppress hunger and are used to reduce weight. So, use of a stimulant has become routine. It is difficult to imagine the life without tea, coffee, cola drinks, and beetles. So, this is all about the psychotropic drugs. Where, if we talk about the why are amphetamines used, amphetamines can be used for medicinal purpose. The most common legal use today are to treat narcolepsy, hyperactivity. They are also used for illicit purposes, the most common of which is to stay awake for long periods of time, and used by drug users to treat the unpleasant effects of other drugs. Now, after this, The second main group is here, that is hallucinogens or psychedelic drugs. So, what are hallucinogens? The hallucinogens acts mainly on CNS and greatly alter one's thought, feeling, and perceptions. They are known as psychedelic drugs. They causes optical or auditory hallucinations like illusions, apparent perceptions of external objects or sounds not actually present. The illusions may be pleasant or unpleasant. The hallucinogens are also called vision producing drugs. Now, according to classification, hallucinogens are divided into two classes, in which the first one is natural hallucinogens, and the examples are LSD, mescaline, psilocybin, hemp products. And the second is synthetic hallucinogens, and the examples are PCP and MDMA. Now, we will see each and every part in detail. So here, the first psychedelic drug is LSD. So what is LSD? LSD is the most potent hallucinogen. LSD is a crystalline mediated alkaloid obtained from the dried fruiting body sclerotium of the ergot fungus, a parasite Ascomycetes fungus, Claviceps purpurea, and pathogen of ryegrass, also called rice mud. It was synthesized by Hoffman in 1938. LSD is smoked by the addicts. Here you can see the LSD high effects in case of psychological effects, hallucination, sensory distortion, paranoia, and euphoria. According to physical effects, sweating, increased heart rate, increased body temperature, and dehydration. If we use extreme LSD, then psychological problems occur, psychosis, flashbacks, and depression occur. So, LSD, in this picture you can see the Claviceps purpurea, the plant from which we got LSD. LSD causes nightmares, horrible dreams, hallucinations, floating sensation, chronic psychosis, and severe damage to the central nervous system. It may cause unconsciousness and even death. LSD also brings about the chromosomal and the fetal abnormalities, pathological conditions caused by LSD abuse or by eaten grain affected by ergot is called ergotism. An LSD dependent person can be readily identified by incoherence in writing. Now, here you can see that now mescaline. Mescaline is a white powdery alkaloid. Mescaline is obtained from the dried tops called mescals of a small spineless peyote or whiskey cactus, that is Lophophora williamsi, native to the SW United States and the northern Mexico. Now, if we talk about the effects of mescaline, mescaline causes alterations in mood, changes in the perception, reveries, visual hallucination, delusion, that is false belief, depersonalization, to lose the feelings of one's own reality, etc. Mescaline also increases the temperature and the blood pressure. Mescaline is available as a powder, as gelatin capsule, and as a liquid. So for the preparation, it may be inhaled or taken orally. Now, what are the difference between mescaline and LSD? Mescaline is a catecholamine-like psychedelic drug. It produces an acute psychotomimetic state with prominent effects on the visual system when taken. Effects can last for about 10 hours. LSD is a serotonin-like psychedelic drug. It produces an alterations in thinking, emotions, arousal, and self-image. Time is slowed down. Visual alterations or the characteristic phenomena effects last for about 6 to 8 hours. So, if we talk about the mescaline is always used in a powder form or gelatin capsules or a liquid preparations, or inhaled or taken orally. Now, Here in this picture you can see that psilocybin, which is also called indocybin. Psilocybin is obtained from the fruiting bodies of the Mexican mushroom, that is fungus Psilocybe mexicana family Agaricaceae. Psilocybin is used as a hallucinogenic agent. Mexican aborigines use psilocybin to induce trances. Now, according to availability, psychobilin is available as a powder and in liquid form. After this, now PCP, that is phenylcyclidine piperidine, which is popularly called angel dust. PCP is available as a white granular powder. PCP is used as a hallucinogenic agent. It can cause profound psychological and behavioral disturbances. Overdose may produce hypersalivation, vomiting, fever, or even coma. According to mode of use, PCP may be taken orally, smoked, or injected transvenously. PCP hydrochloride has analgesic and anesthetic properties. It is used by veterinary doctors to temporarily immobilize large animals. Now, after this, MDMA, that is methylene dioxymethamphetamine. MDMA has recently become popular with the students under the name ecstasy drug. MDMA has CNS excitant and hallucinogenic properties. It seems to relax inhibition and enhance communication. So here you can see the immediate effects and the long-term effects of the MDMA. Now, cannabinoid, that is product of hemp plant. Four drugs, namely bhang, ganja, charas, and marijuana, also called marijuana, are obtained from the dried leaves and flowers of the hemp plant, that is cannabis indica and cannabis sativa, commonly called bhang. Hemp here effects of MDMA. Before this, you can see here the effects of MDMA are vomiting, confusion, skin rashes, coma, night sweat, injuries, stomach cramps, etc. Now, MDMA stimulants and hallucinogenics properties can heighten awareness, causes mood changes, distort perception, distort sense of time, and enhance tactile experiences. Now, cannabinoids. Hemp is an annual herbaceous plant native of the West and Central Asia. It is cultivated for its cortical fibers from which twines, ropes and coarse fibers are prepared. It grows wild in India. Bhang is a common ritual recreational intoxicant in many countries. The most active principle of hemp plant is tetrahydrocannabinol, that is THC. Hemp products may lead to heroin addiction. Now, what are the effects of the cannabis? Reddening of the eyes, decrease intraocular pressure, dryness in mouth, sensation of heat and cold on skin, increased heart rate, and relaxation of the muscles are the effects of cannabis on our body. Now, hemp used as a drug which dilate the pupils, raise the blood sugar level, and increase the frequency of urination. Their other effects includes red eyes, dry mouth, lightheaded, etc., which you can see in this picture. And the hemp drugs are often mixed with the tobacco and smoked. Now, the first one, that is the bhang, which is the type of here, that is cannabinoids. Bhang is obtained in India from the leaves and male and female flowering shoots of the cannabis indica. It is taken orally as an ingredient of the drink or food. It is a mild intoxicant and acts slowly. It is not a health hazard. Second is ganja. It is a solidified resinous extract of the dried unfertilized female inflorescence with the stem of hemp plant, that is cannabis sativa. It is smoked in cigarette. It is more potent and acts almost instantly. Now charas. It is a pure resin obtained from the female flowers and leaves of selected varieties of cannabis sativa. It is the most potent hemp product and is usually smoked with tobacco. It may be chewed or drunk. It is called hashish in America. Liquid hashish called hash oil contains a high content, that is 30 to 40% of THC. And the last is marijuana. Marijuana is obtained from the dried inflorescence and the top leaves of female plant Cannabis sativa. Now, 11 negative side effects of using marijuana are addiction, memory loss, social and anxiety disorders, paranoia, heart damage, lung problems, low testosterone, appetite irregularities, risk of greater potency, decrease in motor responses, and poor decisions. So, these are the 11 negative side effects of using marijuana. So, poisoning by cannabis preparations is called cannabism. Of the hemp preparation, marijuana is the least potent and chacharas is the most potent. Now, here you can see that some slang names of certain drugs. So, like according to slang name acid, chemical names is LSD. Slang name is angel dust, and the chemical name is PCP, that is phenylcyclidine piperidine. Brown sugar, that is diacetyl morphine hydrochloride. Coke is cocaine. Downers is the barbiturates. Grass is marijuana. Hash is concentrated tetrahydrocannabinol. Magic mushroom is psilocybin, and speed is amphetamine. So these are the some slang names for used for this type of chemicals. Now, after this, plants that provides drugs. So here you can see that some name of plants, family of plants, drug yielding plant parts, and the name of the drug and its type. Like Papaver somniferum, family Papaveraceae, and the drug yielding plant part is the latex of unripe capsules, and the name of drug and its type is morphine, codeine, and heroin. Next is cannabis indica and the cannabis sativa, a family Moraceae. The drug yielding plant part is leaves and flowering shoot of the plant, and the examples are bhang, gaja, charas, and marijuana. Theacinensis from Theaceae, dried leaves used, and the name of drug is caffeine. Coffea arabica from family Rubiaceae, plant drug yielding plant part is dried seeds, and the name of drug is caffeine. And the Theobroma cocoa family of plant is Sterculaceae. Drug yielding plant part is dried seeds, and the name of drug is caffeine. Erythroxylon coca, that is Erythroxylaceae family, dried leaves and young twigs used, and the examples are cocaine and crack. Next is Lophophora williamsii from the family Cactaceae, and the drug yielding plant part is measles, and the name of drug is mescaline. Now the name of plant is Claviceps purpurea, and the family of the plant is Ascomycetes. Drug yielding plant part is fruiting bodies, and the name of drug is LSD. And the last is Psilocybe mexicana from the family Agricaceae, and the drug yielding plant part is fruiting bodies, and the name of drug is psilocybin. So this is all about the types of drugs. This is the end of video in which we know about the types of hallucinating drugs, which are psychotropic and psychedelic drugs, and their effect on the body. The next video will be on biotechnology. So if you understand this video, then like and share it and subscribe to my channel Anupma Biology Classes. If you have any questions, any queries or any suggestions, you can ask in the comment section below. Thank you for the watching.